So if you've been told that you have scarring or arthritis or something along those lines, and you're kind of frustrated because you don't really know what to do, then you're going to want to listen to this story. It's about how Shockwave really made a big difference in Charlotte's life. And I can't wait for you to hear her story. So welcome, Charlotte.
Hi, how are you?
I'm good. So tell us a little bit about the first issue, your jaw issue, like the history and kind of how you got here.
Well, I had been going to a dentist just down the street from Empower, and I've had a lot of old fillings replaced with porcelain crowns. And she got to an area on this lower left jaw that she could not get numb with Novocaine. And she told me she felt resistance with the needle, and she said, here's your options. We can call in a anesthesiologist for about $1,000 an hour, and they will put you to sleep. Or I recommend you go down to Empower and see if they can either identify if it's TMJ, which we did not think it was. She really thought it was scar tissue.
Yeah.
And I had had a root canal done 30 years ago that was done by a dentist who really shouldn't have done it, caused a lot of injury. That's probably where the scar tissue developed. But anyway, so I went into Empower and I had my first Shockwave treatment, which is it's an interesting feeling. It doesn't hurt.
It is.
It's just a kind of a knocking on your skin. And immediately after the first treatment, my entire jaw felt like a wet sponge. I couldn't describe it any other way. Something was going on in my jaw. I could hear it crunching in my ear. I knew something was happening. And I think we went through about 6 treatments or so
We
with
only did
that.
four on the job.
We only did 4 on the jaw.
Yeah,
Okay.
yeah. I thought that the jaw was probably going to need that much. But
Okay.
we would
So,
know because we didn't have really any baselines for you because it's not like
right,
you had any range of motion issues
right.
or like you had really no issues. It was just tightness,
It was,
like
yeah.
scarring, exactly what she said. And I was like, oh my God, we're going to do shockwave. And then we'll go and you'll do the procedure. And if anything, if they still feel like there's a little bit of tightness, we'll come back and we'll do another round. But
So I went last week for the procedure. And she numbed me. I was numb to the other side of my face. It was so successful. It went up through my eye. Everything was numb. She had no problem getting my mouth numb. So that problem is resolved. But even before I went back to the dentist, I thought, could this help other parts of my body?
yeah,
I'm
so we went to the
58 and I'm
thumb.
in pain a lot of
Yeah. So tell us about your thumbs. That was the next body part that we went and did shockwave on. What did the doctors tell you was going on and what options did they give you?
I had fallen down a staircase and hyperextended my thumb years ago, probably 10 years ago. I thought I had broken something in the base of my thumb because it hurt like a break. And went to a orthopedic and they did x-rays and he said, it's just arthritis. You've got arthritis starting in there. So I've suffered with that for a long time, opening jars, even holding the steering wheel in my car gets a little painful at times, and definitely holding my phone. So we started treatment in this area and around the base of my thumb. And what we first noticed immediately was the swelling went down. I was very
When visit?
swollen. I was very swollen. And the swelling went down. All of a sudden, I had much more range of motion, um, very much less pain in my thumb than when I had. Now, if I were to pull it a wrong way, yes, it could still hurt. But I have so much more movement and I'm not bothered by that all the time like I was before.
Yeah, a lot
So,
of people don't realize that like when sometimes when people feel like it's arthritis and it feels like it is and the doctor says, "Oh, that's what it is." It's really can be the soft tissue that is the problem. And
mhm.
so that's what the shockwave does. So if like there's any kind of tightness, degenerative, scarring, adhesions, calcifications, anything like that, it's going to knock it out. Like, and it knocks it out fast. Because I think we only did 4 treatments on your thumb as well.
Right. Right.
Might have had one more than that, but it was around the same kind of
Yeah,
amount of
it was around the
treatments.
same.
And like, yeah. So then we went to another body part.
I don't know why, but for some reason, both insides of both of my knees began hurting a couple of months ago. I felt a little bit of instability in my knees, and my mother has gone through unsuccessful knee replacement surgery. They cut her MCL. I know I'm very familiar with what the MCL can do. So I just kind of thought something has happened on both knees. What have I done? So we start working on the knees, and as you're working, I'm feeling sensations up into my upper thigh. So I
Yeah.
know there's something going on. And after one treatment, my knees felt better. I was rid of the pain was gone, and I haven't had any more of the instability, which felt like I was going to lose control of my knee. That has gone. And I don't understand how that could have happened that fast, but I've not had any more issues with my
Well,
knee.
again, there's people like when you have tissue that's either degenerative or that's like really tight, as soon as you shift your weight to where you're onto that part of the tissue, the body doesn't want you to contract it because it knows it's going to hurt. So it's like it gives away. And
Right.
so if you can get all that to function, then all of a sudden it's like, oh wait, I can take the weight of that now. I can
Mm-hmm.
actually get that muscle to contract where before I couldn't. So it increases your ability to get those muscles to fire. And
Right.
so it does. I mean, it makes sense. Like when you can get all that to feel better, then you'll get the muscles to actually work the way they're supposed to work.
Right.
But if there's any, again, like massive tightness, or that's a really big area that becomes degenerative
Mm-hmm.
around the knee. And we find we can knock that out. Like it's happened. I mean, my right knee is a mess. I've played
Mm-hmm.
soccer and a lot of sports and
Right.
multiple knee surgeries on that one knee. And so, and other injuries on top of that, like
Mm-hmm.
everything happened to my right knee.
Yeah.
So the same thing, I was really excited when I first got the Shockwave, like trying it on my knee, can't wait. And
Yeah.
I was like, holy cat, like I can actually go and do a squat and I can feel my muscles and not my knee anymore. And it didn't matter if I did soft tissue on it. It didn't matter what I did to it. It just was degenerative tissue. So it basically
Right.
takes that tissue and makes it young again. Like
Yeah.
that's the best way of explaining it. It makes it young again. Like there's nothing else that can do
Yeah.
it, but this can. And it can do it really fast,
It does it really fast,
which is amazing.
which is amazing. And, because for scar tissue on some people, the first thing the doctors want to do is surgery to get
Yeah.
rid of the scar tissue, which is going to ultimately cause more scar
Or scar
tissue.
tissue.
And if you can go a non-invasive route, this was so much better.
Yeah.
I
Better,
mean,
faster.
I felt like $1,000,000 every time I left there. I couldn't describe that either,
Yeah.
but it's something about the blood flow and everything. Just you feel better once you have that treatment.
Yeah. And the cool thing that we always do is we always for most people going and doing one session, we're going to know. So we're going to know,
Yes,
like,
right,
is it going to work or is it not going to work? Like, if you
right,
don't feel anything, it's not going to work. We're not going to
right,
waste our time on this. You don't need to be spending more money on this. Like, you'll
right,
know in the first session if it's going
right.
to work or not, because you'll feel something and then you'll also feel better afterwards. So
Yeah.
those are things that is also great, because it's also like another tool for us on like, why is
Mm-hmm.
this person not getting better? Well, let's just go and see what the tissue is, because maybe the tissue is
Right.
just like, needs, there's a scarring, calcifications, whatever. There's something that's in the tissue that even if we try to exercise it, it's not going to work. And then we can diagnostically go like, yep, there it is. Like, can you
Yeah.
feel that? And you can
Yeah.
have tissue that you're going over and you're like, why is that wrapping? That wraps around where my pain is. I go, yeah, that's because that's where it is. And that's where it's referring to. And it goes away, because we've had people that had, a massive calf strain, and like that was able to heal like 50% faster. Brand new,
Yeah.
massive, like tore her muscle. Like it was bad. She
Yeah.
healed so much faster. But when we hit other spots, she goes, whoa, that must be an old injury, because that I feel that around my ankle and I have that pain all the time and I never know
Yeah.
what it was. I'm like, it's an old injury that we
Yeah.
basically like broke up the scarring. And she goes, it's gone. I don't have any more pain around my ankle anymore. It's gone.
It really assists your body in helping you heal naturally.
Yes.
I mean, I anyway, I had never heard of this before.
Yeah.
and I'm so glad. I'm actually thankful I had the issue with my jaw
Well,
because it led me to
there's
some other
always
things.
blessings in things that maybe we don't see as a blessing, but it
Hmm.
brings a blessing to our life. I mean, I see that a
Right.
lot, like with even things that have happened to me, and I'm like, why did this happen to me? And then all of a sudden,
Yeah.
I'm like, oh, now I know why, because there's
Yeah.
so many blessings that happen after that that never would have happened if this didn't happen. And
Yeah.
so, yeah, there's always those things. We can't wait. We're going to get, so we have radial shockwave, which basically does like the soft tissue,
Hmm.
but we're going to get next year focus shockwave. They'll actually do some bone healing and even some of those deeper tissues that we can't get to. So when people have like really like osteoarthritic knees, we can get those feeling
I
so
think
much
that's
better. So we're so excited to be
phenomenal.
getting that here pretty soon. I got to go to a conference first before I buy it because I really want to learn a little bit more because that one you got to learn you got to learn a little bit more about that one. That
Yeah.
one's a lot more powerful. But we're excited to get that too. We're always looking for things that can help
Yeah.
us feel good, especially as we age because I want to feel good as I age. So I'm really kind
I
of
do.
finding things for me.
I do
And my
too.
patients get like the bonus of it.
Yeah, absolutely. Absolutely. I feel so much better. And back to my jaw, I did not realize the restriction I had on opening my mouth, but now
Yeah.
I can open my mouth much wider. I don't
Yeah.
feel stretching. It
Yeah.
feels normal.
Well, you just because that's what was normal to you. You're like, well,
Yeah.
that's just my normal every day. Like, I can
Hmm.
still eat. I don't have any limitations, but I didn't
Hmm.
realize that it was that tight.
Yeah.
What would you tell people that are on the fence of coming into the office? Because we do get people sometimes who are like, oh, I'm not really sure.
I would take the chance 100%. I would. I mean, my thought was, could I bring in this anesthesiologist? Yes, but then I'm going to have to bring one in if I ever need something else.
Yeah,
Why not try to solve the problem?
absolutely.
It's not painful. I told Stephanie several times, it's kind of like somebody's tickling your funny bone because it does, you feel it in other areas, but that's what the healing is doing. It's
Yeah,
going in and destroying things that don't need to be there, that are
yeah,
restricting your muscles or whatever.
yeah,
I think that you can go once, like she said, if it doesn't work, it's not going to work, and
yeah,
they're not going to waste your money. But if it
yeah,
does, you're probably going to feel some instant relief, and you go back for a series of sessions,
yeah.
and then you probably don't have to deal with that.
Yeah, like it's rare that you ever have like for you to come back in 5 years saying I need to go do this again. It
Uh-huh.
won't happen.
Yeah.
And honestly, on every single body part, it probably was about four treatments on every single body
Yeah.
part. Each body part had four treatments, which is nothing compared to what it
No.
could have been.
It's nothing compared to the pain
Yes,
that
exactly that
you're
too.
in. I've told countless numbers of friends, and both of my sisters are supposed to come, and they've got issues too. So we've all got issues, but
Oh, everyone
it's
does,
it's
myself
so
included.
nice. Well, I'm just glad to have you in my arsenal of healthcare.
Yes. Yeah.
So
Well, awesome. So I'm so glad that you came on to share your story because I know it's going to help someone hear this and they're going to be like, oh my gosh, maybe this is going to be the thing that actually can help me.
yeah, I'm very, very, very grateful that I went, and everything has helped me so much. And I'm just thankful, like I said, that my jaw had an issue so I could find you guys.
Yep.
So
Awesome. Thank you so much.
you are so welcome. Thank you. Bye bye.